This is Dr. Blevins with Enilda Clinic at enildaclinic.com. So I'm saying that because I am going to take this video and I'm going to put it on all my social media and on my website. Today I'm going to show you guys some specific stuff that I talk about with my patients whenever they come in when their kids are experiencing some aggression behaviors. The big thing that I want you to know before we get started is that for child aggression, you should always go chat with your pediatrician, right? Just get a good developmental exploration, see what's going on there. And then I highly recommend that you go to a child psychologist so that you can investigate and figure out why your child is having aggression. And the reason for that is that one, there's no way I'll be able to give you an intervention today that's going to reduce aggression for your specific circumstance. And the question I got from the parent was how to deal with aggression towards peers at school. And so I'll use that as an example later on, but I think it's really, really important to know that none of these intervention, like I can't give you a specific intervention, and I'll tell you why. Because aggression's a behavior like anything else. If you think about nodding being a behavior, sometimes we might give like a weird eye contact to someone in response to something they say. If you think about how you're sitting, I tend to sit the same way whenever I'm on my couch right here, over and over and over again. Pretty sure that's one of the reasons why I continue to have back problems. It's a behavior though. You guys might be sitting a different way from me, you probably are, and that behavior leads to different consequences. And you're triggered to do it in certain situations. I don't sit this way in other chairs, I only sit this way on my couch. Okay, so my big point here is that aggression is utilized like any other behavior in order to get a need met. And so I wanted to take you guys through this little graphic that I use. I was running late today, so we're going to use a folder. And this is what we think of in applied behavioral analysis world. Basically, what it's going to show you is kind of the smallest unit of learning. So the smallest unit of learning is this. This is called the behavior contingency. The A stands for the stimulus, the B stands for the behavior, and the C stands for the consequence. And so if we think about aggression as being right here, being the behavior, then in any intervention, what we're trying to do is we're trying to figure out what that behavior is doing for this child. What is the consequence that this child gets whenever they demonstrate aggression? Now, I'll tell you that that is harder to figure out than what most people think. Often, I would say 99% of the time, whenever I start to ask questions to parents when they come to see me, they think they know why their kid is being aggressive. And they will say, oh, it's this. They might give like an emotion. It's like, oh, he's irritable. Oh, an intention. Oh, he's just trying to get out of doing chores or something like that. And it's important to know, again, the reason why I recommend you go to providers is that figuring out that reason is often very difficult. And I'm going to show you why. So if we look over here at the consequence, most parents are giving me the immediate consequence. Okay? So what happens right after that child does aggression? So I could imagine in most situations, if I see a child aggressing towards another child in the classroom or on the playground, I'm going to be like, Billy, hey, right? I'm going to start yelling. I'm going to be a lot louder than that. I'm not going to do it to you guys right now. But that's going to be the immediate consequence. That's what most parents or most teachers will report to me, is that very first thing that they do with the kid. And I think it's important, though, to recognize that there are other consequences that likely are a part of that behavior contingency. And I like to call those delayed consequences. So we have that, immediate and delayed. And what we want to do as parents or teachers is we want to recognize that the delayed consequence might be what's maintaining the child's aggression. It might be the need that the child is fulfilling through aggression. And so whenever we think about aggression in that way, then it starts to make it easier to do treatment. And so that's what I try to do in the beginning and pretty much throughout the whole middle portions of my therapy sessions with clients who are aggressive is we're trying to identify the contingency. Now, if you are fortunate to go to a board certified behavior analyst who can either come to your home or works in a clinic, then they will do what's called a functional analysis, different than a what do they call it? A function behavior assessment. It's not that. I forget what it is. It's an FBA in the schools. Those are two different things. So a functional analysis is whenever we're figuring out the ABC, okay? So we figure out who needs to be present, right? The A could be a particular person. So in our school example, it could be a particular student. It could be a particular teacher. At home, it might be the siblings present. It might be that mom is distracted. You never know until you figure out the full contingency. So if you were to go to a behavior analyst, they would set up a very structured study with your child to figure out what is the function or the maintaining factor in that aggressive behavior. There are 4 things that we usually think of as maintaining factors. One is attention, another one is escape, another one is tangibles, and the last one is self-stimulation. So let me go into what those mean. So attention could be any kind of attention. It can be for little kids especially, but even as kids grow into middle age and into teenager years, if they have a history of getting negative attention, what many parents out there probably already know is that it's like they're immune to it, right? It's almost like they want it. Yeah, that's true. If they do behaviors that evokes that negative attention from you or from a peer or a sibling over and over and over again, that's a form of attention. And for children especially, they don't differentiate between that negative attention and that positive attention. So while it might feel very negative for you, it probably doesn't feel quite as negative for them because they have such a learning history with it. Now it could. I'm not saying it absolutely wouldn't feel bad, but it could. So that one is attention. A key with attention is that oftentimes I'm seeing with kids, they want a particular type of attention. They want to roughhouse, and roughhouse is natural in children. So siblings who are roughhousing and playing, that's totally natural to do. All mammals roughhouse, and sometimes the child might be provoking another child in order to get that higher level of attention, in order to get that physical contact. Sometimes it's just quality contact. Sometimes the delayed, I see this all the time, the delayed consequence, I can't see anything, okay, oh, it's over here. The delayed consequence many times is that the child is getting this very warm, empathetic talking. They get to, if they're at school, now that's from the parent, but if they're at school, they get to go to the sensory room or the take a break room, and in there will be lots and lots of toys, and typically what I've seen is the person in the room gives very high quality individual attention. And so if you think about this being our formula for understanding why behavior is maintained, then if let's say that the child is overstimulated, so let's define that one, escape, that's what I'm thinking of. So for escape, that's whenever the kid is trying to get out of a situation that's irritating for them, or it's overwhelming for them, or you can kind of think about the emotional situations where you feel like you're going to lose your mind. Any of those emotion words that fit there, that is one of, that's how your child's feeling whenever they need to escape or take a break or get help. Those are all the key words that parents tell me that helps their children who need escape. So I forget my point before that though. I try to talk faster because I realize I talk really slow and then my brain can't keep up. what was I going to say? I don't know. So let's just define the rest of them. Self-stimulation, or I think there's another way to say it. But basically, what it is it's anything that feels naturally good to your body. So eating food, sleeping. Sometimes it's just moving. Sometimes it's just like needing stimulation, like needing to get up and move your body. Those kinds of things. We know it's that whenever we can't identify another reason for it. Whenever you have an adult who has better language skills, they can oftentimes state, it just feels really good to go for a run, right? Like they'll state certain things that just feels good to their body. And for children, sometimes that's harder. And then, so we did attention, escape, self-stimulation, and tangible is the last one. So if you think about the sensory room, again, at school, there's lots of fun little items. There might be coloring in there. There's probably going to be little toys that you can like squishy around and balls you can bounce on. There's sometimes swings you can swing on, all kinds of stuff in there. All of that's tangible because it's something that the kid can actually access. So any kind of games, any kind of toys, any kind of food items, like candy food items, you know, all of those are what we would consider tangible. Those are our four main categories that can be broken up as far as what could maintain aggression. Again, this is my third disclaimer here. People are not good at just observing their child and knowing what is maintaining their child's behavior. I can't tell you how often, and even the school, like working with schools, how often the people involved are incorrect in identifying the function of behavior. That's why it really does take somebody who's very well qualified. I think BCBAs are the best qualified people. I think it's important to do your due diligence and start with the medical provider, get referred to the psychologist, then get referred to the BCBA, because if there's any underlying health issues, if there's any kind of underlying thought or emotional differences, we want to know about those so the child can be fully supported, right? So, disclaimer there. I don't want you to think that you can look at this video and create an intervention for your child. It's probably not going to be possible. At least one that works. And that's my other thing, is that when parents do come up with interventions, which all of you have, right? You're parents, you're doing your best, you're trying your hardest. So if your kid is aggressive, you're probably trying out lots of little things to see what helps them not be so aggressive. The thing that I see is that the parents have a hard time differentiating between immediate and delayed consequences. They also have a hard time understanding the antecedent or the stimulus that tells the child if they do the aggressive behavior, it will receive that positive, rewarding consequence, or the removal of something that doesn't feel good, right? And so, oh gosh, I keep losing my train of thought. So what I see is that with interventions, oftentimes the aggressive behavior goes up and up and up over time. And that's usually when parents end up in my office because they've tried every trick in the book and they are like, I don't know what to do. I don't know what is causing this kid's problems, right? Like, or their aggression. And they're like, it could just be spurred by anything. And so at that point, what that tells me is that the child now has a learning history that goes on for a good long while. And so this ABC is getting so complex. And that starts to get really difficult. So another little disclaimer, it's always easiest to address a behavior problem in a child as soon as the behavior problem starts. Many times you'll hear people say to you, well, let's just wait and see. That's not great advice, okay? I think there's very few things that we want to just wait and see about. Usually with children, they have certain ages where they're developing certain types of skills, and their lives are so short. If they practice a negative, inappropriate behavior for 3 years, that could be 3/4 of their life that they have practiced that inappropriate behavior. And so changing their learning history becomes harder and harder and harder the longer they're doing an inappropriate behavior like aggression. So with all of that said, let's go to the specific consequences, or I'm sorry, the specific example of what the parent asked. And she said, how do I help my child not be aggressive to peers at school? So what I would think about, one, is your child's language abilities. This is probably the biggest thing that I see is the reason for aggression. That means that your child cannot utilize other behaviors, right? They can't utilize age-appropriate behaviors like saying, I need help, or I don't want to play with you right now, or I want to play something different, or, you know, any of those verbalizations. They have a harder time doing that. And sometimes parents don't realize that there's a language difficulty there, or sometimes they already know it's there, but they didn't realize it was so closely linked to the difficult behaviors the child's having, including aggression. So that's usually the intervention I end up doing, is language. So if your child is aggressing towards a peer at school, I would look at, one, really trying to pin down the function of the behavior. Why is your kid doing it? And then two, give them an easier way to get that need met. And so most of the time it's language. Sometimes it's going to be something different depending on your child's individual profile. What I want to close out this video with saying is that if you have a child that is aggressive, or let's say you have a couple of children and they tend to be more aggressive with each other, this is not necessarily unusual. I said that, you know, kids roughhouse, but if they practice behaviors that end up just shaping up into true aggression, I don't want anybody to feel like, oh no, this is bad on me as a parent or something like that. That's not the case at all. Many parents come in with these concerns. In fact, I would say for me personally as a provider, most often I have highly intelligent parents bringing in their toddler / preschool age children. And again, it's language, right? Because their children are probably developing more of a gifted profile. And so the parents speak to the children with really advanced language for the child's age. The child cannot understand all the time. They can understand sometimes, but not all the time. And so these misbehaviors start to develop. And sometimes that includes aggression. And so, oftentimes what I see is that the parent has done everything they can, everything that's in their skill set, everything that's in the school skill set, and they just really truly want something that works. And so I have never, in my experience, had a negative impression of a parent bringing in their child because their child was aggressive. So I want to just totally knock out any of those stereotypes, okay? Because I don't think that's the predominant reason. I mean, of course, sometimes there might be something going on, but it's not the predominant reason that I see for aggression. I want to make sure if there's any questions on here, I answer them. So if a child gets a consequence at school for bad behavior that day, should there also be a consequence at home too? I think, Mom, you should be the leader of the intervention. Everything that I just said, right? You should be at the school saying, how does this consequence support my child in using a more adaptive behavior to get their needs met? What is my child's need that they're trying to get met through aggressive behavior? And I wouldn't focus necessarily on the fact that they had a consequence. That usually means punishment. We want to kind of steer away from punishment because punishment doesn't teach. What we want to do is we want to teach a more adaptive behavior to help your child get their needs met, help them to advocate for themselves, help them to have, you know, more flexibility and social skills, whatever it might be, right? And so I would focus on the behavior contingency with your child's school. So what is it that my child needs when they aggress, and how are you helping them to learn a more appropriate adaptive behavior to replace aggression so they can get their needs met? Those are the questions I would take to your school. I don't know what that means, Amanda, or would that be double? I'm not sure what that is. Okay, and then Shay is just saying, yep, this video is applying for her. All right, guys, I hope that this video was helpful. I'm from Alabama, and I tried to talk fast, and I realized whenever I play it back, it's going to look like I talk slow. But I really did try, guys. Okay, so make sure you go to enildaclinic.com. You can sign up for the learning videos there, and a reminder to all of my people in my positive parenting Q&A group that I'm posting this on the internet, that anybody who's not yet in the positive parenting Q&A group on Facebook, feel free to join us. So I post there once a week with questions that parents ask. All right, I will see you guys next Wednesday. Bye.